Well, a few months ago, we investigated why so many who enter our local jails die in them. Eyewitness News reporter Leslie Valle spoke with several experts, families of loved ones who died while incarcerated.
Everybody know that my son, we don't know nothing right now. It's been 3 days.
Days after his son died in jail custody, a grieving father has a message for St. Louis City leaders. Release the footage showing what happened in the moments surrounding his son's death. Samuel Hayes was being detained in the City Justice Center awaiting trial on a first-degree murder charge.
She was arrested for shoplifting cold medicine. 3 months later, she was dead in a jail cell, face down, her body severely dehydrated, her skin peeling, surrounded by the stench of infection. Her name was Madison Jensen. She had lost 37 pounds in 3 weeks, couldn't eat, and begged for help. The jail nurse said it was detox, but Madison wasn't on drugs. Her real crime wasn't shoplifting. It was being sick inside a system that doesn't care. And Madison wasn't alone. In U.S. prisons and jails, inmates die every single day, many from treatable conditions. Others vanish quietly under the weight of despair. A few are snuffed out in bursts of violence that leave no clear story behind. But to understand why so many people enter the system alive and never leave it, we have to break apart the myths, the data, and the disturbing truths that rarely make it to headlines. And it starts with the most shocking number of all. Section 1. The illness that kills the most inmates. More than 8 out of every 10 deaths behind bars are from illness. Not violence, not overdose. Illness. It's not what most people expect when they think of prison. But the truth is, prison is often the final chapter for people already living in poor health. Some come in with cancer, others with HIV, hepatitis, or diabetes. Many are already dealing with heart disease by the time they're booked. According to the Bureau of Justice statistics, 90% of federal inmate deaths and 87% of state inmate deaths are from illness. And of those, nearly 2/3 are caused by 4 major conditions: heart disease, cancer, liver disease, and age-related complications. That statistic alone would be tragic enough. But what makes it even more heartbreaking is how many of those illnesses were pre-existing and manageable. In fact, nearly 94% of age-related deaths inside state prisons were due to pre-existing infections, and 2/3 of chronic illness deaths were traced back to conditions inmates already had when they were admitted. So why aren't they surviving? The answer lies in something far darker than disease. Section 2. Dying from neglect, not illness. The 8th Amendment of the U.S. Constitution guarantees prisoners the right to adequate medical care. But what happens when that care is little more than a clipboard and a shrug? Negligence inside the system is difficult to measure, but easy to feel if you're the one trapped inside it. Jails and prisons often contract with private healthcare companies that are paid to cut costs. This creates perverse incentives. Inmates wait days or weeks to see a nurse. Life-saving prescriptions go unfilled. Symptoms are dismissed as faking. For people like Madison Jensen, this wasn't just poor service, it was a death sentence. And when families sue, institutions rarely admit fault. They argue the person died of natural causes. But ask any doctor outside those walls, and they'll tell you dying of dehydration, sepsis, or untreated diabetes isn't natural. Section 3. The violence of indifference. In 2018 alone, 120 state prisoners died from violence, not just from other inmates, but from staff use of force and injuries that happened before they were even booked. Homicide is rare in prison, yes, but it's not non-existent. It accounts for about 2% of state prison deaths and 3% in federal prisons. And what's more chilling, even when violence isn't physical, it can still kill. For instance, being locked in solitary confinement for weeks or years has been directly linked to mental breakdowns, psychosis, and what often ends in a silent death. And that leads us into the next category of deaths behind bars, the ones nobody talks about until it's too late. Section 4. the ones who couldn't take it anymore. Jails see a far higher rate of self-harm deaths than prisons, and it's not hard to see why. Unlike prison, where people have long sentences and can settle in, jails are filled with people awaiting trial. Many are only there for a few days. Some are innocent. Most haven't been convicted of anything yet, but that doesn't stop the mental weight from crushing them. In 2019 alone, nearly 30% of all jail deaths were ruled as intentional self-harm. Imagine this. You're arrested for a non-violent offense. You lose your job. Your kids don't know where you are. You're humiliated. You're locked in a freezing cell, surrounded by strangers, denied your medications, and you're supposed to make it through the night with your sanity. It's no wonder some don't. Section 5. Drugs, detox, and deadly withdrawal. More recently, jails and prisons have seen a surge in drug-related deaths. Some are overdoses, others are withdrawal deaths, slow, brutal, and mostly preventable. When someone addicted to opioids is arrested and suddenly cut off, their body goes into shock, vomiting, sweating, pain, seizures. It's dangerous. Sometimes it's fatal. Yet many facilities have no plan to safely detox inmates. Instead, they're told to tough it out. They're locked in a cell, given a bucket, and ignored. Section 6. Data that doesn't add up. If you think it's hard to believe these deaths happen so often, it's because we rarely hear about them. That's not by accident. For years, watchdog groups have raised concerns about the accuracy of in-custody death reporting. Some deaths are misclassified. Others are simply not reported at all. There's no single federal database that tracks all deaths inside every jail and prison in real time. And when institutions investigate themselves, transparency tends to disappear. In 2014, the Death in Custody Reporting Act was passed, requiring states to report deaths to the federal government. But enforcement is weak. Penalties are rare, and many states simply don't comply. Section 7. Death after release. It doesn't always happen inside the walls. Some of the most devastating prison-related deaths happen in the days or weeks after someone is released. A study published in the New England Journal of Medicine found that formerly incarcerated individuals are 129 times more likely to die of a drug overdose within 2 weeks of release than the general population. Why? Because they're sent back into the world with no support, no job, no medical plan, no mental health counseling. Their tolerance is gone, but their pain remains. And when they try to ease it the same way they used to, their body can't handle it. It's like tossing a drowning man back into the sea and hoping he'll swim. But sometimes, death isn't even the most terrifying outcome. Section 8. When death is preferable. There's one last cruel irony in all of this. For some incarcerated people, death feels like the only way out. They write letters begging for help. They file grievances that go ignored. They lose years of their lives to appeals. They watch people around them die. Some are elderly. Some are terminally ill. Some are just broken. And what the system offers them is not healing, but warehousing, isolation, bureaucracy, a slow grind that wears away their hope until all that's left is survival or surrender. This is the reality of dying in prison. And while we've talked about the different ways people die on the inside, there's one thing that ties them all together. Conclusion. Whether it's illness, neglect, violence, despair, or a final relapse, the one thing nearly all prison deaths have in common is this: they were preventable. Not all, but many. And when a system treats human life as a liability instead of a responsibility, death stops being a tragedy and starts becoming a statistic. That's the most dangerous death of all.